our next section is research and training opportunities. This is where you're looking at, well, what is it that you want to get out of a program? And you want to ask them about these things. So what types of research is being conducted? Okay. Sometimes there's not any research that's being conducted. Sometimes there is, some, but it's in some area that you just couldn't care less about, So it's all they're doing is they're doing behavioral medicine and pain management, and they're doing tons of research in that area. And you're like, I don't want to do that. Okay. Well, you need to know, is that going to be, maybe that's a terrible fit for you. Maybe if they are spending more time on research and they have very little time to give you clinical experience, then you don't want that place because you want clinical experience. So you want to be thinking about those things. Okay. If you're going to be doing research, and if you're in, I will tell you, if you're in a PhD program, you will be doing research. They all are going to have some research. Even those that are relatively light on research are heavy compared to a master's program or heavy compared to a PsyD program. So you're going to have to do a fair amount of research in a PhD program. So the question here becomes, how are you going to do? When you are accepted into the program, are you going to work with one researcher and they're going to mentor you throughout the time? Or are you going to actually work a bunch of different labs where you float between labs? I've got a slide later on training models, because the training model will tell you a lot about how you're likely to work in this setting. But that's important for you to consider, because you may go, I want a mentor that I'm going to work my entire time with. And you may go, well, you know what? I don't want to get stuck with one person. I'd like to flow around, and I'd like to try this research and that research. And I'm really interested in children, but I'm also interested in adults, or I'm really interested in schizophrenia, but I'm also interested in, pain. Okay. Well, those are different labs, research labs, and you'll want to decide, do they have those things that are necessary for you? As far as clinical experience, you want to ask them and find out about, do they have in-house clinics? And if not, what do they do? And they probably, in that case, have an external sites of some sort. So you want to find out what those are. Most large programs will have an in-house clinic. So that means you are providing clinical services at the department. And sometimes the department, there'll be a separate building someplace else that provides clinical services. And those will be services to people from the general public who will come in to provide therapy or assessment or whatever that is. And you'll be supervised in those cases mainly by faculty that are at the university and in that program. External sites they'll send you out someplace. They're often called practicum placements. Some places will call them internships. In psychology, we call an internship that very specific 1 year. Other places will call it an internship if you do basically what would be a practicum. So you may go someplace for a semester. And those may be, VA hospitals. It may be another local hospital. It may be a nonprofit mental health center. It may be a child and guidance center. It may be a, CPS. Could be a lot of different settings. And you want to ask them, what are those settings? What are those external sites that I might get sent to? What are my options? Because those may really help you decide whether a place is a really good site for you. Okay. Especially for the doctoral programs, those of you who are interested in clinical or counseling psychology, you want to find out, what are the clinical internships that people go to? Where are you sending them to? So for example, in our program, we send a lot of people. We're more SMU is more research oriented, but our clinical services, we have a lot of people who are interested in the VA hospital. So that is one of the primary places that our interns go. So when they finish their doctoral program with us, they have to do the 1 year internship. VA medical centers are really probably the most common one. We also have some other research centers that they go to, and they're much more likely to go to a research center in a hospital than any other place. So we don't send a lot of people out to community mental health centers for internships. We don't send a lot of people out to, let's say, a regional medical center that has no research at it, those kinds of things. Now remember, that's specifically for the internship, not for our practicum placements. Our practicum placements are pretty varied, but for the internships, it typically is just a few different kinds of places. The postdoctoral fellowships, and that's in this case, I'll call it post-degree. We usually think of them postdoctoral fellowships. What are they getting? After they finish that training, they have to do a year before they can get licensed in psychology. Where are they going? What's happening to them? Okay. And this is all for training. Of course, it's important to find out where they get jobs as well. But as far as just training, these are the kind of the questions that will help you determine whether that place is a good fit for you.